I think the future is bright. I think that there is a lot of room for future studies.
And that's the cool thing with nursing in general, right? Whether it's nurse practitioner, nursing, there's so many facets of nursing. And
look at us, we're all three different nurse practitioners, but we're all we all kind of come together for the same stuff, you know?
Yeah. As a society, we're all just trying to like get through the end of the day, right? And you know, if you do what you think is right for your kids, but anyway, at the end of the day, like, does that influence everything? I think so.
All right, you ready?
Yes.
All right, cheers.
Cheers to another episode. We are so excited to have you here.
Thanks for having me.
All right, everyone, this is Allie Janas. She's a great Basin orthopedics, and Allie's amazing. How long have you been a nurse practitioner for? Same as me, right?
Since 2011.
2011. Okay, so like 15, 14, almost. 15 years.
Yeah, long time.
But Allie, she's been in orthopedics ever since you've been a nurse practitioner.
Yeah, so I did 2 years in neurosurgery, and then the rest of my career has been in orthopedics, like inpatient, outpatient, and urgent care.
Yeah.
Orthopedics.
And then Allie left The Rock, who probably really misses her because she's amazing, and went to Great Basin Orthopedics and has to deal with my brother-in-law, which she's a saint for. And she opened up the first urgent care over there, too, which is amazing.
Yeah, it's done really well. It's been just a great resource for the community, I think. Gives patients choice and options and access. So we're looking forward to continuing to expand that as we grow.
And we're going to call it your marketing team right now because a lot of people don't know you have an urgent care walk-in.
I know, we are working on it.
Because it's not marketed that much.
I didn't know that.
See, her husband works at Northern Nevada as an ER doctor, and you did not know that.
Well, we don't talk about medical stuff usually.
But you should know they had a walk-in
Well,
clinic.
I know, it's been a minute.
We also did see your kids at that walk-in clinic.
Listen.
So
that was on Travis's time.
Yes.
Well, because I just call him. I'm like, we got a problem. And then he just
takes him.
Yes.
He's like, I'll take him to Allie. Thank God for Allie. We've had broken foots, broken wrists, and I'm like, don't leave. Stay there. We're coming.
Yeah, it's been great. And we're looking to expand. We are open on weekends. And then hopefully very shortly we're going to expand to 12-hour shifts. So we'll be able to see patients before work and after work. Awesome. And, after sporting events is the big goal.
Yeah.
So we're really looking forward to that. We have a good team. We have another PA that's going to join us too. So I'm really looking forward to that. Just change.
And you guys do a lot of sporting events for like the high schools, like you do Minogue
and we're also present at the McQueen games in Northwest Reno, and we also see a lot of kids from Galena and then Damani Ranch, but really all over. I take care of quite a few kids, like in Sparks for wrestling too. It's just word of mouth, which is really kind of special. So patients are treated well, and they come back, and then they bring me their family. So I think that's really important marketing too.
And the rodeo.
I agree.
And the rodeo.
Oh, yes.
They're doing the rodeo, too.
Yes.
And the team docs for UNR, too.
Yeah.
So, we have a lot of kind of fun relationships in the community.
Yeah.
They're all over the place. But Allie was also talking the other day about how she was seeing women with frozen shoulder. And I was like,
Yeah, so...
menopause, perimenopause. Here's all of our symptoms. And we're going to learn about the ortho stuff of menopause.
So there's not a lot of good research, which you've talked about often on this podcast as it pertains to hormones and a lot of different chronic things. But frozen shoulders, tendinopathies, and bursitis are some of the things that are coming up in the literature really only in the last 5 years. So there's been a couple of studies that have come out on frozen shoulder, and they have such small sample sizes that it makes it hard for us to change our practice entirely, because we really cannot say beyond a reasonable doubt or with statistical significance that hormone replacement therapy does treat these symptoms. However, we do know that women are our highest presenters of frozen shoulder. So frozen shoulder is where you get the scar tissue like adhesions, and it locks your shoulder down. And it prevents you from being able to move actively, or even me being able to move your shoulder. And so that results in a ton of pain. And so it's...
Have you seen men with frozen shoulder? I feel like I've never seen a man with frozen shoulder. Have you? I hear it from women all the time. But men, I'm like, oh, you have frozen shoulder. But I've had so many women with frozen shoulder.
It happens.
I don't see many men.
Yeah, that's true. But I just don't feel like I've heard it. Have you seen a man with frozen? You have?
Oh, for sure.
Okay.
Yeah. I mean, it's also correlated with things like injury, rotator cuff tear.
Yeah.
They even link it to like cervical radiculopathy or pinched nerve in your neck where you're just like, you can't move your body and then it
just gets
results in this stiffness. Yes. And so what happens is you get some pain in your shoulder and then you stop moving it because if you move it, it causes more pain. But it actually leads to a stiffening and then an adhesion process. And so it's almost counterintuitive. So, we do see it in men, but it is way more common in females. And so that's why they're trying to figure out why that is. And so there was a cool study that even they cited as like 99% increased risk of adhesive capsulitis if women were not treated with hormone replacement therapy. But even in that study, it did not suggest clinical significance, right, or statistical significance. And so it's still hard to change our treatment options. However, it is like starting conversations like this, right? It's all about like, hey, maybe you should talk to your primary care about hormone replacement therapy or what stage are you in, menopause or perimenopause?
Yeah.
Like, could this be also a contributing factor?
Yeah, because I mean, they're not going to walk into ortho and you're like, you have frozen shoulder. I think I'm going to start you on HRT. Like, that's not going to happen.
I don't have any business doing that, right?
Right.
Like, I'm
just like I don't have any business putting somebody's shoulder back into place. I would mess you up.
Yeah, that's my role. We all play our roles, right? Yeah.
Allie loves this shit. She is
sure
like,
do.
I love the bones. I love the breaking. I am. And I'm like, oh my God, that's so scary. I don't like this at all. Like,
Well, thank God that we have you because I'm not doing what you do.
No.
I don't have any business.
Yeah.
And that's the cool thing with nursing in general, right? Whether it's nurse practitioner, nursing, there's so many facets of nursing. And
look at us. We're all three different nurse practitioners, but we're all we all kind of come together for the same stuff, you know?
Yeah.
Yeah.
Which is great. But yeah, no, so Allie's not going to go and say, I'm going to give you a hormone, but at least you're recognizing it now and say maybe you should be on hormone or maybe you should at least look into it.
Well,
because
it was
we're seeing this trend.
Yeah, I had a patient the other day that was such a great example and I was like, I'm so glad you came in a week before we were here with you, but she had the pellet and insert.
The hormone pellet. Yeah, we all feel the same way out.
I don't know about it, if I'm being honest with you, but she had her pellet and...
Did she have the testosterone pellet?
I don't know.
She probably did.
I don't know what questions to ask, but she had some sort of pellet situation. And then I shot her in her hips with cortisone, not, anything else, but shot her in her hips with cortisone. And she did a little like home exercise program and she was 100% better. And so there was recently just a study that came out looking at bursitis or inflammation on the side of your hip. And they're showing that women that do hormone replacement therapy plus physical therapy plus have education about it do so much better than their counterparts. And that study was actually very promising. So that's cool. Interesting. Yeah.
I think it's like us talking more about it too, because women will be like, I have frozen shoulder. I want to get injected. I have frozen, and they'll keep on doing it, but maybe they're not treating the root cause either.
Yeah. We've had a couple of patients that now that this research is coming out made me think back and I'm like, I think that maybe they didn't respond to traditional treatment as well as maybe a male counterpart does because we're missing a component, right? And whether that's hormone or some other magic something, it's suggesting that obviously there's a hormone imbalance. But again, like changing our whole treatment, we still have a long ways to go with that. But they've been harder to treat. I've had a couple where I'm like, what? Why are you not responding after very traditional treatment like somebody else would? So there's got to be an explanation.
Oh, totally. Yeah. And, you weren't trained. I wasn't trained. You weren't even trained that we should look at hormones. Like that wasn't even part of our curriculum at all. Like any of it. It was just like, you go through menopause and then you're done. So like us saying like, oh, this is coming out about, estrogen depletion and possibly frozen shoulder. That wasn't even thought about when we went to school. So all this new research coming out, like, yeah, we might have like mistreated our patients, not on purpose, but just because we didn't know the information.
Well, it's interesting because they have known about estrogen's impact on tendon health for quite some time. So they actually looked at female athletes with normal menstruation, and they've actually related when our estrogen levels naturally go up in a cycle, that's when athletes are at higher risk, specifically females, for ACL tears. So
like during ovulation?
And so what happens is when the estrogen levels are higher, our tendons are actually actually a little bit more loosey-goosey or have too much laxity to them, leading to sprains or injuries. So moving forward, I think what we're going to see is that there's going to be a dose range specifically for like tendon and bone health, because if we shoot too far or too high, then we can lead into too much potential laxity. And who knows, in an older woman, right? Like if we can't even increase their tendons, elasticity by so much that they're at increased risk for fall. But those studies in younger women would suggest there probably is a dose range.
Mm-hmm. Yeah, that's fascinating.
It is. And I mean, I think with the hormone replacement therapy, it's really hard to get up that high unless you are doing something like Allie said, like pellets, because just bioidentical hormone replacement therapy isn't really going to push you up so much to that ovulation range, because that's usually like the 500s, you know what I mean? But depends on what modality you're doing for the hormone replacement therapy, right?
For sure. And that's
like
the other
injections
point
or pellets or bio. It depends on what you're doing.
For sure. And that's the other part of the research that hasn't even begun, right? Like what is the most effective way for tendon health specifically to administer hormones? So they haven't even been able to really 100% prove it. We know there's a suggestion. We know this. But then we have to figure out what is the dose range, but also what is the most effective method.
Yeah. There's going to be so many for hot flashes and your tendon health and osteoporosis and this is going to be your perfect dose range for your hormones, but everybody's going to be different, because some people can't handle estrogen, some people need more, so it's all going to be
for sure
different. And then osteoporosis, you put that in there, and we know hormones help osteoporosis risk.
Yeah, proven. Estrogen is heavily influenced in bone health, right? So it makes our bone builders, our osteoblasts, last for much longer. And it also inhibits the osteoclasts, or the bone breaker downers or remodelers your eating bone too quickly. So we have this homeostasis that rides for a period of time until we get to a point where the estrogen decreases. And then there's an imbalance, which leads to fragility of the bone. So more of the bone eaters than the bone builders. The latest stuff that looks like it's come out is that when you are entering perimenopause or menopause, it's actually the first 2 to 4 years that you have the highest amount of bone breakdown. So actually earlier treatment is essential to prevent fractures.
I wonder if that's because your progesterone is going first.
And so they actually don't know, because the newest research is actually on follicle stimulating hormone. So follicle stimulating hormone rises 2 to 3 years before your estrogen decreases. Right. And so now they're looking at treatments for that. Can we predict bone health by tracking this number in our 40s? Or is there a blocker that we could use that could also prevent progression of osteoporosis, which is kind of interesting too. That's the future of osteoporosis treatment.
Or we put people on low-dose hormone replacement therapy earlier.
And I think it would be great to be able to get DEXAs on women much earlier and sooner, right? Yeah. To get a baseline. Also, we were able to do that for me, which was really great to see, because my follicle stimulating hormone shot all the way up to 29. Yeah, and then we started me on hormones, but we went ahead and got that DEXA just to
get a baseline.
And obviously I was so young, but it was at that point where you're well, you're 40 and you have to basically replace your estrogen. Otherwise you're at such high risk for osteoporosis.
Well, and again, that might be our earliest screening tool, right? Is that FHS hormone instead. So watching that instead of a DEXA scan, right? And if we're starting to see it trend and peak, well, now it's probably time to start estrogen replacement therapy to prevent that bone loss.
Yeah.
And I bet they feel like crap at that point, though, too.
I think it's all part of those perimenopausal symptoms, right? I don't think you know what you're feeling.
You're
Well, yeah, exactly. I think you are experiencing something. You don't feel like yourself. You know that something is off, but it's almost
you're walking around with one shoulder.
Well, you keep adapting as women do, and then all of a sudden you're no, something is really, really wrong. But it can take a while before you actually seek out help, I think.
And also waking up with okay, now I have pain in my ankle.
Yeah.
Well, and my hip hurts today, and you can't explain that away with just I slept wrong for the rest of your life. I don't know. I think that is definitely a suggestion.
Yeah. On the counterpart, did you see the guy? Have you guys seen the guy on TikTok or Instagram, or else we don't watch TikTok, that always talks about perimenopause? And he's like, ladies, everything you say is perimenopause. It's just you're getting older. Like, what do guys call it? Just getting older. And I'm like, well, I mean, we are 40, so we are getting older too. But I have to say, when I started HRT, my like small joints, like finger, when you get out of bed in the morning and you step down and you're kind of like, oh, I'm sore. Mm-hmm. I feel like that mostly went away.
The tops of my feet hurt, which was so strange for me. I would get out of bed and I would step down, and the top, not the bottom, but the tops of my feet just ached so bad that I would have to like put on slippers. I couldn't even walk barefoot, and I was like, I have rheumatoid arthritis. Like
and it went away.
It went away.
Yeah.
That's interesting.
Yeah.
Like even like the little joint pain just like goes away, which is really nice.
It is nice. I mean, obviously it suggests like there is a level that we should be at for like peak health, right?
Mm-hmm. Totally.
Yeah.
Yeah. And like, 13, isn't it? Which I see all the time. Why are we going into perimenopause so much earlier? Or are we just not checking for it? Or our moms just help with it?
Or it's our toxic environment.
I was going to say environmental factors, like, where we have higher weights, we have higher rates of metabolic disorders. All of those things contribute to general health and feeling, right?
Yeah.
But I don't remember my mom feeding me all that well when I was a kid.
We had a lot of mac and cheese.
I had a lot of kid cuisines.
Do you remember those?
Do you eat dinners where you would like lay out your like tray? And
Don't you remember it? And it had like your fruit and your vegetable.
Okay, first of all, I would have never remembered that until you just said that right now. I could have been 70 years old and been like, oh my God, kid cuisine. I just remember
I've never had a kid cuisine. I don't know what that is.
I feel like you need to buy one. Do they even offer them anymore?
I don't know. But there's
Probably not a good idea.
I mean, there's
bad
like
for your
man
health.
meals.
I remember seeing man meals.
Yeah, similar type
Like
thing,
TV
but for
dinners,
kids.
like
Yeah,
TV
no, I
tray
know what you're...
dinners?
Like, I know a TV tray
Like you would
dinner.
actually get your TV tray out and eat dinner. Like
My
an
mother,
80-year-old.
that is one thing she was neurotic about. Like, we had nothing. We had no cookies, no chips, no nothing. Like, I would be
sad.
like,
But
I
those
want
were they were marketed as like
Yeah.
healthy options for your kid.
And the sodium level
course.
was 5,000 grams.
yeah,
Yeah.
but
Milligrams.
Well, I mean, still to this day, we think a lot of the things that we're eating are healthy. Sure. And they're not.
well, and what we
protein
once
bars.
thought was healthy is not.
Yeah.
And like, what does healthy mean? I don't know. There's so many things that you're like, drink water, but don't. And then
Yeah,
don't
and
drink
like
too much.
remember, like
or-
low fat and low sugar was healthy, and now we're like,
We're
eat
like,
your
no,
fat
no,
and
no.
eat,
You need actually more
Yeah.
cholesterol. Yeah. I
for your
know.
brain. It's,
You need less inflammation, more cholesterol.
yeah,
Less
it's
inflammation.
changing all the time.
Yeah.
I know.
So I don't know. I think as a society, we're all just trying to like get through the
Figure
end
it
of the
out.
day, right? And if you do what you think is right for your kids, but anyway, at the end of the day, like, does that influence everything? I think so.
Oh yeah, for sure. I think so.
And so if you feel like you're starting to get stiffness in your shoulder as a woman and your inclination is to not use it as much, you're saying, like, at what point do we go, okay, maybe this is just frozen shoulder and we just need to do more stretching, some PT, move it more, or like I need to come in and get evaluated and
So I think everyone's
Make sure it's not something
pain
else.
scale is different, right? So I would say that you start to get pain in your shoulder and it's not really explainable, or you didn't really have an injury, right?
Yeah.
So there was no injury. The worst thing you can do is put it in a sling.
Yep.
Right. So like I said, like I tell my patients, motion is the lotion. And so to maintain even passive motion where they're taking their other hand to move their arm in all planes is important. Now, if you can go to the gym or you have access to a gym or even online through orthoinfo.org, which is a pretty good
Orthoinfo.org. Pin it.
ding. Yeah, but like a very reputable website, right? So a website that patients can use that have patient-friendly handouts about range of motion and exercises you can do from home with bands. And then if you're getting to the point where it's just progressively getting more painful, it's so stiff that you can't move it, then you need to come see somebody.
Or you're
So
sleeping at
early
night.
intervention
Yeah.
is better than waiting too long to the point where you're like, I can't move your shoulder more than 40 degrees to the side. You've
Yeah.
waited too long.
Yeah.
And then if it's like frozen shoulder severe, they put you under anesthesia and break
So I
up
would
all
say
that.
that We are going
tissue.
to do things like stronger anti-inflammatory medications, a cortisone injection to help with pain control, and then we're going to torture you in therapy.
Oh.
Yeah.
So
Rough.
nobody wants to go to surgery unless we have to,
No.
right?
Yeah.
There's risks with surgery and anesthesia.
Yeah.
So we usually try and do at least 1 or 2 cortisone injections 3 to 4 months apart with therapy that entire time before we're going to take you to surgery. Unless you're so locked that we're like, what is going on here? You know, and we're just not getting anywhere.
Yeah.
But yeah, we will take you to surgery. We'll put you under anesthesia and then manipulate your shoulder.
And then they'll break up what she's saying.
She's like,
is
manipulate.
they're going to break up the scar tissue and yank it from here to there, and it's going to crack, and it sounds terrible, and I could never do it.
Correct. And then we block your shoulder. So we put
I
some
think I
numbing
would be into
medication in
that.
You would.
I love anything gross and poppy and crunchy and yeah.
I don't.
there. Love it.
Like give me a cyst or like
So
that's very
gross.
different.
You
But
guys are nasty.
Love it.
it's good. It's gratifying.
Satisfying. Yeah.
Yes, right?
I asked Levi what he wanted to be there today, and he said a dermatologist, like shave so he could make a lot of money. And I was like, do you know that you have to pop pimples? He goes, never mind. I was like, yes.
I know Shay doesn't really get it either, but I like that we're on this track.
Allie and I are like, be a radiologist, be a dermatologist.
Yeah. Grayson says he just wants to be a doctor so far. I'm like, are you sure?
Quinn said radiologist. She was like,
she listened to you then.
So she was like, I would like to work from home in my basement. And I was like, doing what? And she was like, looking at computer screens. And
You're
I was
like,
like,
perfect,
I was like,
radiology.
okay, like, what do you mean? She was like, the doctor that looks at the computer. And I was like, got it, radiologist. Yeah.
Yeah. I'm like, that would be her personality too. Like, don't talk to me, just leave me
Quinn
alone.
was so funny when I brought Grayson
She told me about it the other
sandwich.
day.
I was like, Quinn, can you give Grayson a sandwich? She's like, yeah.
She goes, I said, here, Grayson, here's your sandwich. And he goes, who's it from? She goes, obviously your mom. 'Cause it's from my favorite muffin. I was like, you're such a shit.
I know. The twos
I like her
are...
sassiness.
She's
It's
so
good.
sassy. She would be a great radiologist. She would
Yeah.
just like be a radiologist, do her own thing, and they would surf naked on the beach.
Yeah.
I mean,
see?
nobody came to my class and talked about that on career
No.
day.
No.
Like, you get to stay at home in your
Read
pajamas.
films.
Yes.
You could be in your aviator nation like I am every time Robbie drops off the girls. And I'm like, sorry, Robbie. I get home and this is what I change into.
You can do that from Hawaii,
Yeah.
or wherever you'd like. Yes,
We love our jobs.
yeah.
We love them.
I'm
do.
good.
I love my job. But
I
look,
love my job.
If you are not a people person, you should be a radiologist.
Or an anesthesiologist.
No,
Right? You
They
still
kinda
have
have to be
but
personable.
I do find that the anesthesiologists always have great personalities. Don't
They
you
make
think?
laugh.
I think most anesthesiologists are really lovely.
I think so. Yeah.
Yeah.
The ones I've met.
they
Yeah.
have to make you feel somewhat comfortable.
Somewhat comfortable,
right?
yes.
Because they're the first and last person that you see as a
Yeah.
general rule.
Yeah.
right.
But, they do work with people that are asleep most of the time. So, like, you can, like, if you're kind of like an ambivert.
They're the ones that can like turn it on. And be
yeah, like, you
"Ah,"
can
and
be
then you're different.
extroverted, but also you kind of like your quiet time.
Yeah.
Yeah, and if you like the nurses and the doctor, surgeon
That's
yelling at
true,
you,
too.
so
Yeah.
thick skin, right?
Yeah,
I
like
would
a
cry.
cold
You
room.
would?
Oh yeah. I'd be like, I'm sorry, I messed
No.
up. Yes, I totally would.
Really?
I could be an anesthesiologist. No.
You've
Well,
not been
maybe I could.
slapped on the wrist by a doctor as a nurse?
Yeah, a couple of times. We won't call them out who they are. But it's fine. No, yeah, I don't know.
Oh,
I don't know if I
You're
could do it.
sensitive.
Yeah.
Yeah. Get your
No, I
feelings
haven't
hurt.
been called out too many times. I'm pretty good at my job.
I just remember like being was I in nursing school? I must have been in nursing school and being like in the OR and they would be like, "Can you get me a from the back?" And you're like, and, like you're afraid to ask them for what they said, and then you try to like go back in the back and you're like looking through all this stuff frantically trying to find something, and then you bring back the wrong thing and they're like, "No, you idiot. That's not what it said."
Yeah, it is like the TV shows. Like
Yeah.
you do get called an idiot, and you're
Yeah,
like
you
crying.
feel
At
like
least
an
we
idiot.
did. I mean, that
Like-
was like 20 years ago.
yeah, but
I've
don't
never
you know
been
some
called
of
an
those, like,
idiot, but-
OG nurses.
Yeah.
that are like, you are not going to speak to me like that. Let's speak clearly. And I'm like, yes.
Yes.
Let's be honest. What Allie is saying is true. The nurses were worse than the doctors. Like I would get called out by Feline. I hope she's watching. She's probably not. All the time. She would be like, "You're too young." I'm like, "You're 80." I was 20.
Oh, I
Feline
love
called me
those
out all the
OG
time.
nurses. They just don't take shit from nobody.
No, she
it's
did
like
not.
a sight to be seen.
And you towed the line. Like
For
you
sure.
were like,
You got to earn
I do
it.
not want to mess up with Feline. The
Love it.
doctors, whatever.
And I think it's
Feline,
good because now, I think that the youth of this generation has a little bit of a different, I don't want to call them entitled, but they have
entitled.
a different process to, like, I do feel like our generation really had to work for it. Like, we had to show up and had to
We
behave
went
a
out
certain
to the wall
way.
till 5 a.m. and we were at clinicals at 6:45.
Yes, and you were like
Not sober.
pressed, and proper. And I do feel like the younger generations, and I love them for this, but they're just kind of like just very like, I don't know, casual about it.
No, I think it's funny because my
You
MA
keep
calls me
looking
a
at my
hoe.
bald
And I'm
spot.
like,
Yeah,
no,
see,
I'm not. It's your hair's flipped over. My MA calls me a hoe, and I think it's funny because I'm like, you're such a millennial. Like, it's
Yeah.
just great. You
Yeah.
know? Like, I'm like, oh, okay.
like maybe that generation was too serious, and then maybe the younger generation is not quite serious enough.
Or they'll be like, KK Beesh. And I'm like, what's KK Beesh?
What?
Like, okay, bitch. Like, KK Beesh.
I've never heard that.
I get it all the time.
KK Beesh.
And I'm like, okay.
Mine are usually just like an eye roll and an ignore is usually what I get. And I'm like, okay.
Can
So-
you imagine if we did that, though?
Roxy says, right on top of that, Rose. Every time I ask her for something, right on top of that, Rose. What movie is that from? It
have
was
no
with
idea.
Christina Ricci. Or no, Christina.
Thank God something the babysitter's dead. Isn't that
Yes.
the
Oh my
babysitter
God,
movie?
stop it. That was from
Yes.
so long ago.
Yeah.
Yes. And then, so I saw a
You mean
post-
that doesn't like
And then I was like, oh yeah, Rose was kind of a dick. Is Roxy calling me a
She
dick?
probably is. Oh, that's funny. You know, I feel like I don't know how we got started on this, and I don't even know what we're talking about.
It's okay. We do that.
It's fun. Anyways, if you guys have any ortho issues, go see Allie.
Yes.
I'm here to
She's
help.
amazing.
Yes.
At least listen.
She had to see my poor entire family last week. We all rolled in like one big giant mass.
Well, hopefully everybody's better is what I'm hoping for.
Everyone's better. Levi's playing soccer, and Dan just complained for 24 hours about his hand.
As he does.
He does.
Yeah.
I was
it's
like,
about 24 hours for.
look,
Yeah.
I've had that into
What did
my
he
toe.
do?
Allie injected him into his joint, and he was
Oh.
like, "Does it look swollen? How's the? Are they looking even? Do they look swollen?" I was like, "She just put fluid into your joint, so it's going to be swollen for a little while." You know me, I give like
Yeah.
zero shits when it comes to my family. I'm like, "It's going to be
You're
swollen." As
fine.
I'm typing, I'm like, "It's going to be swollen for a while. Go put some ice on it."
Also, he knows his injections take 24 hours. And then he's like, it's a miracle.
Yeah.
Every time.
I need you to fix Travis. He's got
Tennis elbow.
golfer or tennis, one of the two, whatever.
Needs to stretch it.
Yeah. And he's been trying, but
Did you even inject those? I thought you didn't want to inject those. Like, I thought that wasn't great.
I think you
to
could do it like
inject them.
once, right? Or something.
Yeah, so it depends. Like, so for tennis elbow on the outside.
Everybody has
after-
tennis elbow. They're going to be so excited about this.
Tennis elbow, yes. So, which is inflammation, tendonitis, right? Just like we've been talking about with our hip and Achilles tendonitis and ankle
It's
tendonitis.
also an
but
overuse injury usually.
overuse, but also strain. So you can lift your groceries. I see that a lot. And they're like, something happened in my arm and it hurts really bad. Or I went to close the trunk of my car and like it strained. But yeah, so normally we're going to try and kick the can down the road with a ton of stretching, like 452,000 times a day is what I say.
Oh.
All day, every day.
Like this.
You're stirring your pasta water. You're
Okay,
stretching your
he's
elbow.
definitely not doing that.
Yes, all day long. Tennis elbow straps, anti-inflammatories, physical therapy with dry needling is super helpful. So in
did do that.
tendonitis or why
Don't
are
let Megan
tendons?
hear you when she talks about that for acupuncture, because she's an acupuncturist and she hates dry needling.
Okay, well it's helpful for tendons.
Yeah.
My physical therapist did dry needling on me, and when my arm was messed up, and it literally
No, it's
fixed me.
amazing. It's
Yeah.
just, Megan's like, she's
Well,
the acupuncturist.
But
Erin just had dry needling at your
It's
office,
super
and she did really,
helpful.
really well.
It's super helpful. It actually causes your tendon to bleed, which
Well, it
draws
just-
inflammatory markers
Just
to
like we were
heal.
talking about with your scalp
Yes,
earlier,
yes,
like with hair loss, it,
Encourages bleeding, so
we need
that
the blood flow to, and the
Yes.
helpers to go heal everything.
Whereas like cortisone injection is the opposite, right? Like, so it draws away inflammation. It draws away like good blood supply to it. So that's why we don't love to. There's also a ton of studies that show that like people who got cortisone injections versus people who didn't in tennis elbow weren't doing any better. Didn't necessarily get better faster. So
I have a question. When you're doing dry needling, is your target the same as when you're doing a cortisone injection, or cortisone injections in the joint, or it's in the muscle?
Depend on what you're treating for. So in this circumstance, this is a tendon problem. So we inject in the tendon sheath.
Okay.
So the soft tissue sac, for lack of a better term, we're not injecting into the actual meat of the tendon, but slightly around that is what we're aiming for.
Okay.
And so that injects the inflammatory medication around the tendon. But in dry needling, it's the same location. So we're trying to poke almost all the way down through the bone a little bit to stimulate that bone to bleed so that it tries to heal itself back to the tendon, or the tendon back to the bone.
Because what I've experienced with dry needling is that just putting the needle in the muscle tissue, it just like, it almost, it inflames it, it spasms it, and then it like releases kind of. Like you can tell when you're doing like a trigger point injection, when you get it in the right spot, it's like,
yeah.
you know?
Like when Megan would do it, you're like, your muscles like,
yeah.
Yep,
So,
to make it bleed so that it heals.
yeah, so that's fascinating. Like the difference between like dry needling versus trigger point injection, right? The only difference is you're throwing lidocaine in it versus...
and it's a bigger needle.
Yeah, probably. Yeah.
Yeah.
That is interesting. Maybe you should go get some dry needling done, or go see Megan for acupuncture. All right, any other pearls you want to give us, Allie? Are we good?
I mean, I think the future is bright.
Yeah.
Yeah, I think that there is a lot of room for future studies and tests. So like just to really prove it, right? That we just need larger sample studies is really what this suggests. So they were just too small to prove anything. Also, I think it's really cool. They're moving forward with changing hormone replacement so that they are receptive to certain genes in tendons and bone. So it's more like these nanoparticles, which are used more in chemo. So in chemo, we're trying to kill the bad cells, but maintain the good ones, right? But they're still all a liver or a colon or a pancreatic cell, right? But we want to maintain the health of the good ones. And so they're trying to do that with hormone replacement therapy, which will be very cool. So to help treat things like mood swings, but tendon health and bone health, and then avoid depositing in tissues that we don't really want them to stick, right? So I think that is the next generation of hormone.
I think we're just starting to re-scratch the surface because it was shut down for so long, and now we're all like, no, we need to like know about this, and so it's coming back to light. But now there's more layers of it coming out, which are just going to continue to come out, which is awesome. Yeah, it's so great for our generation. Like we're so lucky to have that.
Well, and I think it's important for like already this generation that is aging, right? So we have a huge aging population, and so they already expect for like 25% increase in fracture, hospitalization, surgery, and then loss of independence, right? Which is going to reflect on our generation and the one behind us, right? Because we're going to have to be caring for these patients. So if anything, they should have invested, like the people coming up behind us should invest in our health so that they don't have to take care of me when I break my hip.
Yes. And Allie knows this, and I think I've told you before, like we see it all the time. Like one of my biggest fears is you lose your independence, you fall, you break a hip, you end up in a sniff, and then you get pneumonia and die.
Yeah.
But we see it all the time.
The time.
My mom's like, that's so morbid. I'm like, you don't understand. We see it all the time. Like,
no,
I'm
but
like,
it's
oh,
so
shit.
true.
This is the progression of what's going to happen.
Or you live in this land of in between where you really can't care for yourself, but you're trying to, and you can't. Like insurance only affords you 21 days, and then you're like, what do I do now? So
just to maintain your independence throughout your life would be incredible.
Yeah. So, and I think that's the big picture too of like when we're thinking about our health when we're getting older, it's not just, fitness or just checking your labs to see where you're at, but really it's like that longevity piece and really owning your health and owning your longevity and understanding like, okay, what can I do to make sure that I have quality of life as
all I
get
hear
older?
too is like, gosh, these golden years aren't so golden. I feel like I hear that about 400 times a day because it's
I saw your waiting
arthritis
room. I was like, oh.
Yeah. I mean, it's either, people with fractures or it's older people with like joint disturbances or chronic tendinopathies. And they're like, these aren't so golden. But if all it took was sprinkling a little hormone on it.
Yeah.
I mean, that feels like that's all we have to do.
Little Pro-G on it.
Yeah. Yeah. I mean, that feels like hopefully a very simple, cost-effective solution.
Yeah. And I don't know if it's that simple, but at least it's a start, right? Like at least we can start there.
Something to help.
Maybe it is that simple. I don't know.
Yeah.
I don't know. We haven't studied this for so long, so we'll see. All right. Well, cheers to Allie.
Cheers.
Episode 11.
Thank you so much.
Thank you.
That was fantastic.